talk a little about the nexus of high prescription drug costs and the opioid epidemic that has gripped my state, our country, the #1 public health crisis in America today. It's a story of greed, frankly, and it's a story of the need for some fixes here in Congress to keep it from happening again. With regard to the opioid crisis, I think the degree that this is affecting our communities is well documented. 72,000 Americans died last year of overdoses from drugs. This is a high watermark for our country. It's a grim statistic. More than 2/3 of those overdose deaths involved what's called opioids. This would be heroin, prescription drugs, and painkillers, and also the new synthetic opioids, the fentanyl, which is responsible for most of those opioid deaths. I think we've made good progress over the past couple of years here in Congress of passing new legislation to help address this problem, new innovative ways to get people into treatment, longer-term recovery, which we know works well in some instances, and also to do a better job on prevention and education. So I do think those numbers will begin to turn around, but they haven't yet. They haven't yet. We've got much more work to do. The Comprehensive Addiction and Recovery Act, which we passed, is starting to work. The Cures Act is starting to work. And most recently, the President signed legislation to try to reduce the cost of this synthetic opioid coming into our country, mostly from China, mostly through the U.S. mail system based on research that we had done. That's called the STOP Act. So again, making some progress. But these overdose death rates are just unbelievably high. And it's a tragic situation, not just in my state, which is probably top 3 or 4 in the country, but throughout our nation. There is a miracle drug that can be used to reverse the effects of an overdose. And one reason we're beginning to see some progress in some regions of my state and around the country is that we're getting this drug out to more first responders and others who can, in effect, save people from an overdose. And then, of course, the trick is to get that person into treatment, not to just have these overdoses continue to occur. And that's where the more innovative programming is starting to make a difference. But I guess I could say that we have never, in our history as a country, had more of a need for this miracle drug to reduce the effects, to reverse the effects of an overdose. It's called naloxone. And naloxone, again, is something that we're using more and more and saving more and more lives. I'm going to talk this evening about a company that exploited the opioid epidemic by dramatically increasing the price of this naloxone drug by more than 600%, just in the space of a few years. The Senate Permanent Subcommittee on Investigations, which I chair alongside Tom Carper, Democrat from Delaware, conducted a year-long investigation, bipartisan investigation, really nonpartisan investigation, into this naloxone issue. We were concerned about the rising costs. We wanted to find out why it was happening. We focused on a pharmaceutical company called Kaleo and their naloxone auto-injector called Evzio. Evzio. While naloxone is available in generic form, 2 branded products exist for take-home use by untrained individuals in the case of an overdose. One is Adapt's nasal spray called Narcan. You may have heard of that. Narcan is something that many first responders use and know about. But the other one is this Evzio drug, which is, again, the other branded naloxone product. Narcan is available at a cost of about $125 for 2 doses. $125 for 2 doses. Evzio, I thought was an innovative product when it came out. And indeed, it has some innovative aspects to it. A unit includes 2 auto-injectors and a training device that provides verbal instructions to talk the user through using the product. Before Kaleo took Evzio to the market, industry experts who were impressed with the product said they should probably charge between $250 and $300 for this product. Again, miracle drug to reverse the effects of an overdose. They told the company that they could, quote, own the market at that price of $250 to $300 a unit. Instead, the company decided on charging a higher price, taking it to the market in October of 2014. So about 4 years ago, they took it to the market for a price of $575 per unit. With sluggish sales, I think because the price was a little higher than, again, was advised, Kaleo could have lowered the price. Instead, the company went the other direction. it implemented a new distribution model proposed by an outside drug pricing consultant who has installed similar distribution models at other pharmaceutical companies, by the way, and this involves dramatically raising the drug price. Now, let me explain this. As part of the distribution model, Calejo increased Evzio's price from $575 per unit in 2014, again, October 2014, to $3,750 in February of 2016, and then to its current price of $4,100 in January of 2017. So they started off a little high, had sluggish sales, and instead of going lower, they went from $575 to $4,100. That's more than a 600% increase over the space of about 2.5 years. 600% increase in this drug that is so needed right now in our communities. Why did they do this? Well, according to company documents, the new distribution model for Evzio was designed to, and I quote, capitalize on the opportunity of opioid overdose at epidemic levels. So, in effect, from the company's own documents, they chose to capitalize or exploit the opportunity of the opioid epidemic, this tragic epidemic that's killing more Americans than any other thing right now in my home state of Ohio, and the #1 cause of death among Americans under age 50 in the entire country. 72,000 is the number from last year, number of overdose deaths. So, as part of this new model, the company worked to ensure that doctors' offices signed paperwork indicating that Evzio was medically necessary. Why is that important? Well, this ensured that the government programs like Medicare and Medicaid, programs that, as you know, are already programs that we look at every year and think, gosh, how do these costs keep going up? What do we do to maintain these important programs? But they said that they would increase the cost of this drug because they could get doctors to say that this was medically necessary. And that meant that these government programs, Medicare and Medicaid, would cover the cost, regardless of what the cost was, even though it had increased 600% in 2.5 years. So that was the concept behind this new distribution model. It relied on a portion of the prescriptions being filled by patients with commercial health plans that covered Evzio at the much higher cost. And it worked. For people whose plans didn't cover Evzio or who didn't have insurance, Calejo gave the drug to the patient for free. In these instances, the company incurred the roughly $52 in cost of the goods. It was worth it because they could get these incredibly high prices from Medicare and Medicaid. This distribution model worked, as I mentioned, when physicians deemed that Evzio was medically necessary. Then they would cover the cost, Medicare and Medicaid, all the way up to $4,100 a unit. Under this new model, Evzio fill rates jumped from 39% to 81%. So it worked. They sold more product. They made a killing, but at the expense of the U.S. taxpayer and the expense of all of us, really. The majority of Calejo's initial revenue was from Medicare and Medicaid, and the resulting cost to the taxpayer to date has been about $142 million, despite the fact that a much less costly alternative was readily available. You'll remember that for most of this time, Narcan, this other product, not Evzio, but Narcan, was available for $125 for 2 doses. So instead of following recommendations by drug pricing experts to take the product to market at that lower price, the company decided to exploit this loophole in our health insurance market and charge this much higher price to the American taxpayer through Medicare and Medicaid. Our report from the Permanent Subcommittee on Investigations was released on the same day that 60 Minutes aired a new story on Calejo, its products, and why the price was so high. The findings of our report were used in that segment to highlight Calejo's distribution model that transferred the cost of this drug effectively to American taxpayers. You can see our report online at the Permanent Subcommittee on Investigations website. That PSI report and the 60 Minutes segment were both released on November 18th. Today, less than a month later, I'm very pleased to tell you that Calejo has publicly stated its plan to take steps toward now reducing the cost, the price of its naloxone auto-injector from the current price of $4,100 per unit down to $178. This is a very positive step forward, and I'm hopeful that it will increase access to naloxone, this critically important overdose reversal drug that's saved so many thousands of lives already. But I'm also pleased that they made this change because it's going to save taxpayers a lot of money. Make no mistake, I don't believe that this change would have occurred but for our year-long investigation, the PSI report, and the 60 Minutes story shining a light on these incredibly high drug prices. Does anybody really believe that these prices would have been lowered if not for exposing it and the transparency that was then able to show what was happening? So the bipartisan investigation has produced a good result, but we need to do a lot more. Our report includes recommendations to prevent similar situations moving forward. Among other things, our report recommends that the Centers for Medicare and Medicaid Services, CMS, should review its policies governing physician use of medical necessity exceptions for Part D in Medicare to prevent companies from inappropriately influencing prescribing. That's the least they should do. While there are legitimate uses of the exception sometimes, we need to be sure it's not exploited as it was in this case. Congress should also require CMS to improve transparency regarding the total amount spent for drugs purchased by government health care programs so we can identify these problems early on and stop them. And to combat the underlying factors affecting addiction, of course, Congress has to do more here. We should put in place a 3-day limit, in my view, on prescription pain medication for acute pain. Not for chronic pain, not for cancer, but for acute pain. That would make a huge difference. And by the way, it's consistent with the Center for Disease Control recommendations, requiring all states to utilize prescription monitoring programs is another thing we should do. And we should allocate more funding for immediate overdose remedies and first responder training. There's reason to be optimistic, as I said earlier, about the direction our country is now headed to in overcoming the opioid epidemic. We've committed ourselves here at the federal government to do more and be better partners with state government, local government, and nonprofits. That's good, and I'm proud of the work this Congress has done. But the tragedy of overwhelming opioid overdoses has also created this opportunity for companies like Kaleo to exploit, or as they said, capitalize on this public health crisis. That's wrong. It's shameful. I'm proud of the investigative work we've done. I will continue to work in a bipartisan manner to do what we can to reduce prescription drug prices and also protect taxpayer-funded programs like Medicare and Medicaid. Thank you, Mr. President. I would like in another part of the record, if I could, Mr. President, to make a separate statement.
Without objection.
Mr. President, today on the floor, the Senate voted on legislation dealing with Saudi Arabia. 2 issues, the death of journalist Khashoggi and also the ongoing and tragic war in Yemen. You may have seen on the floor somebody who helped to orchestrate this debate, and I thought it was a healthy debate. I thought it was good. People were offered amendments, offered the opportunity to discuss their amendments and debate them in full. I appreciate the fact that at the end of the day, the Senate voted by an overwhelming margin, in fact, by unanimous consent for a resolution that I think sends a very clear signal to Saudi Arabia, to our other partners in the region, and frankly to the Trump administration. The person who was orchestrating this, you may have seen down on the floor here at the Senate, is the chairman of the Senate Foreign Relations Committee. His name is Bob Corker. Senator Corker is leaving after this week, assuming Congress is going to be out of session after this week or next week, and I think we will. He's chosen to retire, not to run for re-election. So come January, we'll have another senator from Tennessee who will be joining us. But Bob Corker is going to go back into the private sector. So today I wanted to talk a little about Chairman Corker, the person you saw on the floor if you were watching earlier, and a friend, but also a very valued member of the United States Senate. The reason other people aren't on the floor talking about him right now is that he chose not to give a departure speech, which is unusual. Most senators choose to take to the floor and give a speech about their departure and their reflections on being here and what they might do into the future, and then other members come and talk about them. Bob Corker, in his typical style, being a guy who's here for all the right reasons, and that's not him, it's about others for him, has said, I don't think I'm going to give a departure speech. So I don't think I'll have the chance to talk about him as we have with other colleagues in their presence, because he's not going to give that speech. But I will say he deserves to have others like me talk about his record, because he has had so many accomplishments. He's been a leading voice in this body on so many important initiatives and issues. As chairman of the Senate Foreign Relations Committee, of course, on the global stage, he's been active, focusing on issues to improve the U.S. image around the world. Our diplomacy is something he believes in and has supported. He is concerned about the U.S. role in the world. He wants to be sure America continues to play the leading role on things like human rights and spreading democracy and opening up channels of commerce. But he's also been very involved on budget issues, focusing on the debt and the deficit and the problems that we face here in this country. And finally, he's been active on other legislative matters. One that comes to mind is banking issues. He's on the banking committee and very involved in how to deal with Freddie Mac and Fannie Mae, and particularly after the financial crisis, some of the issues that arose, and then after the Great Recession. So he has been very active as a legislator. He also brings an interesting perspective to this place, because to this day he would tell you he's a business person, not a politician. And he came up as a developer, a builder. He didn't come up through politics. He did become the mayor of Chattanooga, and that's how he got involved in the political world. But he's got this business approach to things around here, which I think is refreshing. He's also got the work ethic that comes from somebody that comes from the private sector, and that's relentless. I see it on display every day, but I think it's been part of Bob's personality since he was a kid. He started his first job at age 13. That was picking up trash and bagging ice. He started his own construction company at age 25. By the way, that construction company later expanded to 18 states, 17 states, in addition to his home state of Tennessee. And he first entered public service, not in a very glamorous job, but having been successful in the private sector, he wanted to give back, and he was offered an opportunity to help his state. And he said he wanted to be the Finance and Administration Department Director of Tennessee, sort of like the budget person. And he was very helpful to the governor and to the state of Tennessee in that role, and then became mayor of Chattanooga, his hometown. In 2006, he ran for federal office for the first time, and that was for the United States Senate. He quickly rose to prominence as someone who, again, had expertise on some of the issues. That was after the housing crisis, so he was focused on that issue, the housing market crash, and as someone who advocated for conservative principles like reining in federal spending and reducing the United States deficit. In 2012, he was reelected to the Senate handily and has been chairman of the Senate Foreign Relations Committee for the past 4 years. I'm a member of that committee, so I've had the opportunity to see his work up close and watched how he works patiently with Republicans and Democrats alike, and focuses not just on the sound bites and throwing out the rhetoric, but actually how do you get something done that helps our great country. I can tell you with certainty that during Chairman Corker's tenure before the Foreign Relations Committee, our allies around the world have benefited, and our adversaries have been held accountable. That's his approach, pretty simple. He's played a key role in helping restore America's leadership role in the world, and I'm pleased with the work we've accomplished, from combating Russia's continued aggression in Eastern Europe to standing up for our friend and ally, Israel, to what we did today with regard to sending a clear message on values. Just recently, legislation he championed is called the BUILD Act, and it was signed into law by the president without a lot of fanfare, but it's going to make a big difference in terms of helping our country and helping not just our image around the world, but ensuring that we're helping bring other countries out of poverty by using U.S. market forces that work. It helps bring U.S. private sector investment to low-income countries around the world to reduce poverty, to grow investment. And this is important in any context, but certainly today with one of our competitors, China, trying to do the same thing, but using another tactic, not the private sector, but the public sector. It's a perfect example of the kind of impact Bob Corker's had on this body. He's built up international relationships, and he's bolstered our national security all at once. It's been a pleasure working with him, and I wish him all the best. He is a restless guy, so he's going to end up doing something else very creative with his life, I'm sure. And I know he'll enjoy spending more time with Elizabeth, his wife of 30 years, and their 2 daughters and 2 grandchildren. But I'm eager to see what Bob's going to do next. And I know that we will be hearing from him because his thirst for public service and helping others is just too great. So to Bob Corker, congratulations on a career of public service, and I hope you enjoy the next exciting chapter of your life. Mr. President, I yield back my time.